Welcome to your dog's neuter discharge instruction video. All information discussed is going to be sent home with you in written form. Remember, every pet's recovery from surgery is going to be a little bit different. We're here to help and make sure it's the safest, smoothest recovery possible. Your dog's being sent home the day of surgery with 2 different medications. The first is a liquid medication for pain and inflammation. This medication is going to start 24 hours after surgery, and it's of the utmost importance that it be given with food. What you're going to do is pop the top off your individually drawn syringes, pop it in your dog's mouth, and shoot. If you don't think you're going to be able to give your dog medication this way, you can mix this medication with a yummy wet food or a treat. Just make sure they eat the full amount so that they get their full dose of medication. The second medication your dog's going to be sent home with is called gabapentin. It's a pain medication that you can start the evening of surgery. This medication is to be given every 12 hours and can cause some drowsiness, which is actually what we're hoping for during the recovery period. The night your dog gets home from surgery, you can feed about half of what a normal meal size would be. We don't want them to overeat and cause any vomiting. I also don't want you to be concerned if your dog doesn't seem to be interested in food. It's quite common for them to not have their full appetite back for 12 to 24 hours after surgery. After the neuter procedure, it is pretty common for weight gain. So if you notice after recovery that your pet's putting on some weight, it may be time to cut back some of their food. Your dog may be quite disoriented for the next 24 hours or so. This can look like excessive vocalization, panting, pacing, or just generally seeming uncomfortable. For the next 24 hours, I want you to keep a really close eye on your pet on stairs or getting up and down off furniture to avoid any injury. For the next 14 days, it's short on-leash walks only for your dog. This means no playing with housemates, no off-leash play, and no excessive exercise. I'd like you to take a look at your dog's incision area every day. Keep an eye out for redness, swelling, inflammation, discharge, or any foul-smelling odor. If at any point you take a look at it and you're not sure if it looks right, snap a picture and send it to our email or give us a call and someone will get back to you as soon as possible. The #1 cause of post-surgical complications is from dogs licking or chewing at their incision. It only takes 1 lick to introduce harmful bacteria that can cause an infection. That's why your dog's being sent home with a cone today, also known as an e-collar or an Elizabethan collar. Your dog needs to wear this cone for the next 2 weeks. Some breaks from the cone are okay as long as your dog's under direct supervision, but whenever they're being left home alone, it's really important that the cone stays on. Your dog's incision has been closed with internal and absorbable sutures today. That means these do not have to be removed, so you don't have to come back in to see us unless you have any concerns. If you do have any questions or concerns, our phone number and email address are located on the discharge sheet. You'll also find the number for a 24-hour emergency care provider. Now that your dog's been seen by us, as long as no new health concerns arise, you're able to purchase flea and tick medication, as well as come in for annual exams and vaccines. Thank you for choosing us as your veterinary hospital.